Hi Vanessa, how are you?
I'm good, how are you?
I'm good. So we just finished up with Vanessa. This was your third appointment after we gave you your neuromuscular orthotic. I know you sought me out to find some relief for some of the symptoms you were having. Could you briefly describe those symptoms and what was going on and how long it was affecting you?
So, I had been seeing quite a few doctors just for headaches, neck pain, shoulder pain, loss of sleep, and some tingling that I had going on in my fingers, in my arms, like in the upper arm area. And so I didn't know what it was. I had been super healthy, worked out all the time. So I started seeing a chiropractor, and then I had gone to, a neck pain doctor. I had gone for MRIs. And so really the loss of sleep was bothering me because I was such a regular sleeper. And then just the strange sensations. And then, one doctor after another just, didn't know what it was. And finally somebody just said, oh, we think you have fibromyalgia, which, I just
It's basically a diagnosis when they don't know what's going on, right? It's just a blanket diagnosis.
Yeah. And so I happened to be sitting in one doctor's office and I came across a magazine and I read an article for your practice and I read a lot of the symptoms that were listed there and I was like, wow, so maybe I have something going on here that's related to TMJ. I knew that I had been grinding at night because my dentist told me so, and I had been wearing a night guard, but I found I was taking it out in my sleep a lot, and I just, it just didn't seem...
It kind of hinders your breathing. It's not very comfortable sometimes, right? And maybe the reason why you subconsciously take it out at night.
Exactly. And I had been through a couple of them, and they're not cheap, so... So I when I saw the article, I figured, let me
Good. So then we basically saw you, I want to say, gosh, in April of this year, it's 2017, and we got you fitted for an orthotic sometime, I want to say probably in June, if I'm not mistaken. No, sorry, July. So middle of July, we got you fitted for an orthotic. It is now the middle of September. So in the August, September, so in about 2 months now, tell me what your symptoms are like and how your quality of life has been affected, hopefully for the better. So go ahead and tell me what you're doing now.
So definitely an improvement. I'm sleeping better. I haven't had the tingling. And that's really what I think what was keeping me up at night because it would just wake me up out of a sleep. And so that was really bothersome. And so because I wasn't sleeping well, I didn't have a whole lot of energy during the day. And so, and I guess then the second thing would be the headaches. They've gone away tremendously. Headaches that are typical, that are weather related, allergies and things like that I've had, but not like I had before where I was taking Advils, like candy every other day. And I'm not the kind of person to rely on medicine, so I didn't really like doing that. And so it was just a contraindication to the way I live my life every day.
Sure. Well, good. So now that you've been wearing this for a couple of months, you're off the medications, you're sleeping better. Your quality of life, do you feel like you gained some of it back? Do you feel like your old self again to some degree?
Yeah, and not only that, not only have I been sleeping better, but I've been exercising.
Good.
I still have some neck pain, but I truly believe that that's a structural issue. And I've had some shoulder pain, but I know I have a slight tear. Even putting those things aside, I feel like I've been able to get back to a normal exercise routine.
Good. Yeah, because when you exercise, you start feeling better, and it's a cyclical thing. So that's great, and I'm so happy you found us. And sitting in another doctor's office is pretty funny that you try and find me, right?
Yeah, exactly.
But good. Well, thank you. I appreciate it, Vanessa, for taking a few moments here and telling us how you were when you first started and how you are now. And I'm assuming you would recommend something like this for people who are suffering from TMJ who don't understand the connection between the jaw and a variety of symptoms.
And a lot of people don't. I didn't, and I'm pretty, I'm a health and phys ed teacher by trade. I know anatomy and physiology, but I just didn't realize that much pressure on your jaw and the muscles in your jaw could really hinder quality of life.
Big, strong connection. So we are glad that we were able to connect the dots and get you in here to take care of things, and I appreciate the time.
Thank you.
You're welcome.